Hi, and welcome to this segment on A Minute with Mandy. Today I want to give you a little bit of a tip on how you can help to prepare your pelvic floor prior to birth. Birth is a big event, and I think most women would benefit from doing some physical preparation for their pelvis in advance. This particular move can be started around about 30 weeks or so, and it's a great little exercise for you to start preparing the muscles of your pelvic floor for the stretch that they'll need to endure, but also to gain more body awareness in the area of the pelvis, which also will really serve you. For this particular exercise, you need a couple of tools. You need a chair or something to sit on, and you need a pool noodle. Once you have your pool noodle, you're going to place it lengthwise on the surface you're sitting on the chair here. Then you're going to use your hand support if you need, but you're going to gently lower your body weight down over the length of that pool noodle. The idea is to get the pool noodle running directly between your sitting bones. So if this is my pelvis, that pool noodle is running right through the center. You're going to feel a little bit of pressure, but that's okay. It's bringing your brain's awareness to this part of your body, and then your whole goal at this point is to relax. It's to let the pelvic floor relax, melt, soften over the shape of that pool noodle. If you have a tight pelvic floor, this might be a bit uncomfortable, so you may want to start by sitting on a softer surface like a couch or the bed. Once you can sit comfortably on the bed or the couch, you want to progress to a firmer surface like a wooden chair or something not quite as soft, because it's going to give you more pressure and feedback. Remember, the whole goal is to be relaxing here, so doing a little pelvic floor contraction and then melting over the shape of the pool noodle. So if this is my pelvic floor, I contract and then relax, let it soften, melt, think heavy, relaxing, warm sensations. And your goal is to go for about 1 to 3 minutes a day sitting on that pool noodle. Once you can tolerate directly sitting on the noodle, you can start adding a little bit of body movement. So once again, if I'm sitting on my noodle, I can try shifting a little bit to one side, shifting my weight a little bit to the other side, leaning forward, leaning back, exploring that whole pelvic diaphragm to see if there are any areas of particular tightness in one spot versus in another. Once you can tolerate sitting on a firm surface like a wooden chair, now it's time to break out the birth ball and get it a bit more used to. You can try and use your pool noodle on the birth ball. So if I set the pool noodle again on the top of the ball, slowly lowering down, be in a corner if you're worried about your balance, or have a spotter nearby if you see that you need a little bit more support. But the idea here then is to start to do a little bit of massage or rolling or adding more pelvic movements in while you consciously relax that pelvic floor. I hope you found this tip helpful. Go and get a pool noodle.